Hi, this is Dr. Eric Westman with an episode of Ask Adapt. This episode is on keto adaptation. Keto adaptation is the term for the transition from carb eating and carb burning to not eating carbs and not burning carbs. So you're burning ketones instead of the carbs and fatty acids as you did before. So you're basically adapting to ketosis, therefore the term keto adaptation. You don't have to know the term, just realize that in the first few days or week, you might not feel right. You might, if you've been eating lots of carbohydrates for a long time, you might crave them as you miss them. You might have headache. You might have some fatigue. If you're exercising a lot, you might want to give yourself a break for the first week or two. Don't push yourself quite so hard as you transition. Don't freak out if you can't make your goals like you used to. Give it some time. So keto adaptation is just that time period where you go from carb eating and carb burning to proteins and fats as your fuel source and as your food. Now to the questions. Tiffany asks, how do you know when you're keto adapted? Well, most people notice that their hunger is gone or diminished, decreased almost to nothing. So you're just hungry at meal times or maybe just once a day. That to me is the best sign that you're keto adapted, that you're in ketosis. Now enter the word ketosis, which just means that you are keto adapted, or you're just burning fat as your primary fuel. Fats and ketones are burnt together when you're burning fat. So Tiffany, you know when you're keto adapted, when your hunger goes down. If you have weight to lose, fat weight to lose off your body, you start losing weight. If you have inches to lose off your body, you start losing inches. Now you can measure ketones using urine, blood, or breath monitors. Most of my patients don't have to measure them because they keep the carbs so low that I know they're in ketosis. So if you want to try to figure out if you can eat more carbs and measure the ketones, that's great. Otherwise, just keep the carbs low. You know you're in ketosis, Tiffany. Judy says, could the keto diet possibly help someone diagnosed with early kidney failure? So that's not exactly a keto adaptation question, but I don't know. In fact, there's one study with some years ago looking at the keto diet for people with kidney trouble on the progression to dialysis. And it seemed like there was less progression. That's one of those things that you just want to keep monitoring the problem while you're changing the diet. I don't know of any reason why it might be bad for kidney trouble, even though everyone else says that it is. Could you speak a little bit about the increased body odor and acetone breath? Well, not everyone, Larry asks about that. Not everyone gets that. That's a curious thing I find in my clinic, is that when I teach someone using our system, which is eat as much as you want of the meat, poultry, fish and shellfish and eggs, have some couple cups or fistfuls of leafy greens, 1 cup or fistful of a non-starchy veggie with a limited amount of oils, cream, mayonnaise, olives, avocado, half an avocado. That when you use that system, it's pretty rare to have bad breath or a body odor like that. So it might be the other products that are being eaten that are causing that. I know there is a very rare condition, meaning I've seen it once in 10 years, where the ketosis burning fat, there's a rare metabolic condition where your sweat smells, I know this is going to sound strange, but it smells like cat urine. I know it's a very specific thing, and I remember exactly the people or the couple and then the person who had it, and that is a very rare condition. So but maybe you have that, Larry, I don't know. So Shannon asks, I notice when I do my regular cardio class, after 45 minutes I hit a point of no longer being able to do the class. What gives? Well, Shannon, where are you in the time course of keto adaptation would be my first question. If you're in that first week or two, give yourself a break. Don't worry about meeting those goals. Keto adapt all the way, become a fat burner during exercise, and you'll find that you can go even farther than before. If you haven't watched the movies Serial Killers Cereal, or Serial Killers 2. These are the documentary films about elite athletes doing low-carb, high-fat diets or keto diets. It's pretty fascinating. In the one movie, Serial Killers 2, with monitoring, it took about 6 months to hit the peak performance for these elite athletes using fat in the most optimal way. So give it some time, Shannon. Let's see. What about keto flu? Can I avoid it? Well, keto flu is pretty uncommon. That's that term for the keto adaptation symptoms in the first few days or a week, where people feel so bad, they get muscle aches, that some people lay in bed all day because they feel so bad. It's pretty rare. I don't see it in my clinic much at all. Again, it might be how you're starting out. Are you using bouillon to try to prevent the symptoms? If you don't have high blood pressure or a history of heart failure, I would recommend adding some salt in the form of bouillon to prevent those symptoms. So even you don't have to have keto flu. It's pretty rare. And the best way I would say to minimize the chances of getting it is to be strict to your program. Add some salt back if you don't have those conditions, and then you probably won't get it. Marie says, what about hair loss or thinning? This is a common complaint. Well, I'd say it doesn't happen commonly, but I hear it. And it's a common meaning with any sort of weight loss or diet change. In fact, with any kind of stress. So the term, of course, I'll make sure there's not others sort of strange condition going on, but if it's just kind of a thinning process, what's happening is the new hairs are coming in and pushing out the bad hairs. And the problem is it just takes time for the new hairs to grow in. The new hairs will grow in even better and healthier than before. So Marie, just let it have some time. What about Isabel says, what about regularity problems? Well, this is a keto adaptation kind of symptom. It doesn't matter how often you go to have a bowel movement, and that when you're eating in a low carb, high fat way, it's very likely you'll go less often for a bowel movement. That's not a medical issue. But if you have uncomfortable fullness, or you feel like you can't go, or you have hard stools or hard to pass stools, that's called constipation, and that's not a good thing to have. I mean, it is a medical issue. So there are some things that we think about, making sure you have your greens and your vegetables every day, making sure you have plenty of fluids, and even adding some salt to help you hold on to fluid. If needed, 1 teaspoon of milk of magnesia at bedtime for a week will smooth things out for you. And that's really just kind of a transition symptom that, again, most people don't get. But if you do have it, it's not a reason to stop the diet. Just manage it in these ways. Let's see. What about respiratory issues? Until I started this way of eating, I hadn't had breathing problems. That I don't know. I don't think that's related to changing the diet. Shelly asked, is it because I'm eating more fat? No, I don't think so. Most of the time in my patients, I see the respiratory trouble getting better, people breathing easier. So if something like this comes up, I would recommend, if you're really feeling poorly, to see your doctor about it. And it doesn't seem to be diet related to me. What about itchy skin? Not just dry skin, but itchiness with bumps in localized areas. Jim asks, well, Jim, that's not something I see commonly. If you see a whole lot of people, these things happen just randomly. It might be at what time it's happening in relation to the diet change. There are lots of things that people will tell me in the first week or two that then just go away. It may be related to the diet or not. That's just something to wait out and treat symptomatically with something to relieve the itching. Well, that's the questions for keto adaptation. Once you're through that, you don't want to go back. So no need to do it again. And as we're learning more about a keto lifestyle, it's a healthy thing to do. And be sure to subscribe below ask some questions, leave some comments, and see you next time. I hope that's helpful.